Let's queer up health. 50 cities with highest STIs and 2 Florida cities getting top honors may not surprise you. A new report from the CDC sheds light on the 50 U.S. metropolitan areas grappling with the highest rates of sexually transmitted infections. Despite advancements in HIV prevention, STI rates, including chlamydia, gonorrhea, and syphilis, have surged over the past decade, with a disproportionate impact on gay men. In 2022, approximately 1 in 130 individuals across the U.S. were diagnosed with an STI. However, the statistics vary significantly across locations. Health research firm Innerbody meticulously analyzed state-by-state data to identify the cities and towns with the highest number of STI diagnoses. Surprisingly, Philadelphia emerged as the city with the highest STI rates, with 1 in 65 residents diagnosed with an STI in 2022. Following closely behind are Memphis, Jackson, New Orleans, and St. Louis. San Francisco ranks 8th in STI prevalence, highlighting the impact on gay communities. Conversely, Provo, Utah, stands out as a low STI hotspot, attributed in part to its high Mormon population. Florida sees its fair share of STI challenges, with Miami, Fort Lauderdale, Tampa, and Orlando all making the list of the top 50 cities with high STI rates. Miami was a top 20 city. To address this public health concern, Innerbody suggested leveraging guidance from the U.S. Department of Health and Human Services. This includes partnering with pharmacies and clinics to enhance access to testing and treatment, as well as exploring telehealth options. Additionally, the promotion of express clinics offering instant testing could play a vital role in combating STIs. CDC concludes one of the top issues for the LGBTQ+ community is the decreased use of condoms in a post-HIV PrEP environment. I concur with the CDC. I think that, I see it as a single person, when I'm talking to folks, engaging folks, nobody wants to use condoms. They're like, no, I'm on PrEP, so I'm on PEP, undetectable, so why use condoms? And so I think that this is a challenge in our community. I don't think that people realize that, yes, PrEP and PEP protects you from spreading HIV, but it doesn't protect the other things that exist out there, like chlamydia, like gonorrhea, like syphilis, like herpes, right? And herpes you can't get rid of. You can't just go and get a shot, right? You're stuck with herpes for life. I just had a friend who actually confided in me that he's bi individual. He's up in New York, and him and his girlfriend split up, and they had a little break or whatever. And he went out, had fun, engaged in sexual intercourse with somebody who had herpes, caught herpes, gave it to his girlfriend, right? Now you have 3 people infected with this, maybe more, who are infected with this for the rest of their lives. And yes, with medication you can control it, but the reality is these STIs still exist. They still impact our lives, and we need to talk a little bit more about it in our community. I don't think we talk enough about the fact that PrEP and PEP just protects you from HIV, and that there's still these other diseases out there that we need to protect ourselves from. So wrap it up. Wear a damn condom.
I always wonder if it's ignorance, unawareness, education, or, there's so many, or resources. There's so many things we can, throw into the pot, and I always come back to education and awareness. And I think it's just low with this. I mean, you can go to any clinic or any Walgreens or any CVS and get your blood pressure checked. You can take home a lot of tests, but when are we going to, as a community, ritualize getting tested? When are we going to ritualize that? When are we going to implement these as tactics? If you don't wear condoms, there's also PrEP, there's also testing. I think there is just the stigma, and if you're grown enough to do it, you're grown enough to go and keep yourself healthy. And it's just, it's such a
I think you're pointing out a good point of healthcare disparities that exist within different communities, right? And I would love to see the data to be broken down in terms of racial and ethnic groups as well, in terms of who are the ones that are actually have the higher prevalence, right? I think that you would find that probably people in lower economic communities, despite color, despite ethnic background, probably have a higher rate, right?
Right.
Of STI infections because of, again, to your point, education, awareness, access, right? And it's knowledge, right? Like about the fact that you can still catch these other things. Pride Lines is in a community in Miami called Liberty City, where, quite frankly, I've had people come in who stare at me blank when I talk about PrEP and PEP, and that's PrEP and PEP, right? And then I talk about the fact that there are all these others, and they're literally like, "Are you are you joking?" When we're talking about these conversations. So there are still, despite all the advancements that we've made, there are still communities that don't have the knowledge and awareness and or access to the resources to be able to prevent some of these. So I think that this raises a much larger conversation about the health disparities that exist in our society when you divide it between race, ethnicity, and then even more socioeconomic status.
Right, because we can talk about insurance, we can talk about all of those things that play a role, and we can also talk about the places that we just saw: Baton Rouge, Philadelphia, St. Louis. These are cities that are usually the disparities amongst socioeconomic status is a very wide gap. So,
and with high populations of people of color, particularly Black people, right? Let's be real about it. Let's call it what it is. And again, going back to this notion of healthcare disparities, do clinics exist, right? I mean, we have a plethora of them here in Florida. We're very lucky that we have nonprofit organizations who have clinics attached to them. Not enough, quite frankly, in parts of Miami. But in those communities, do they have the same infrastructure and systems that we have? I mean, I'm lucky in Pride Lines, we just April 1st, we just started a clinic, right? We've been testing for years. Now we actually give out PrEP and PEP, and we treat STIs, right? So we're lucky that we're able to do that, particularly in Liberty City, a community that is, resource drained. They don't have a significant amount of resource poured into it, like Miami Beach, where you have almost a clinic or AHF or CAN or one of the other facilities on each corner. Liberty City doesn't have that, right?
mm-hmm.
They have HF there, but they don't have Pride Lines. Right? They don't have that many resources there. So the cities that were indicated, do they have these resources? Do they even exist? And I've traveled to some of those cities. Like Philly, I don't see any pop-up clinics where you can just go get tested and get treated right there, despite not having health insurance. Right? And so we talk about another layer, right? Do people have health insurance to be able to pay for this, right? Because in not all cities can you access free healthcare services.
Right.
So it's very... this conversation deserves a much larger, conversation,
mm-hmm.
because when we talk about healthcare disparities, it's not as straightforward as one would think, right? There's so many layers to this conversation.